So today we've got Dr. Hesham, who works at Northern House Orthodontics, and he's going to be going through the different types of brace. Now, he's a consultant orthodontist, so that means he's a dentist. He's also a specialist when it comes to braces. And as a consultant, he also takes on very complex cases in hospitals. There's layers to his knowledge and experience. And I want to really unpick his brain when it comes to anything regarding braces. So, Dr. Hesham, thank you for doing this.
No, thank you for having me. Really pleasure.
So let's get straight into it. You know, people are always asking, what types of braces are there? And could you just shed some light?
Yeah, of course. I mean, nowadays there's such a huge range, but we'll go from the traditional braces that most people probably have in their mind to the more sort of aesthetic stuff that they're also looking for these days. So the traditional brace it's a fixed on metal brace. It's made of stainless steel and it's glued onto your teeth. So that means you're not able to remove it yourself. But the glue is quite weak. So if you're not looking after it carefully, or if you're eating inappropriate foods, it can still break quite easily. So you have to be careful. And then the teeth are moved by a series of wires which are tied into each little square bracket. Okay, and so these are very traditional. Most children will have these type of braces, and this is probably still the most cost-effective but most efficient way to treat most people's teeth. So it's a great appliance, and still one of my favorites.
So when we say a brace, we're talking about this wire, we're talking about these brackets, and then they're stuck on with some glue.
Exactly, yeah. And so normally when we say brace, we mean any type of device or appliance that can move teeth. So this brace particularly is made up of those components, like you said, the bracket, the wire, and the elastics which hold it on.
Yeah. And is there anything special about the wire? Is it just any type of metal wire? Is there anything special about the brackets themselves?
That's a great question. So these specific wires, we go through a normal series or sequence. So initially we have wires that are made of nickel titanium, and that's kind of like a space age type of material. And the important thing about that is that it moves your teeth with very, very low forces. So rather than using very high forces, which are damaging to your teeth, we use low forces using these nickel titanium wires. And later on, once your teeth are more straight, we use stainless steel wires, which are thicker and are more rigid, so we can move your teeth in a slightly different way. So that's the special thing about the wires. The brackets, they're made in different ways. This specific bracket is made in the most accurate way, and that means that it is cut by a machine, and that means that the production of the bracket is very, very accurate. So when the wire sits into the bracket slot, it means that the tooth position is going to be really, really well defined, really, really well controlled, whereas other brackets that are made using other techniques won't be as accurate. So the final result you get from these brackets that we use is going to be the best.
And is there any particular way to how you place the brackets? Does it matter where on the tooth?
Yeah, that's a great question. So where you put the bracket on the tooth determines where the tooth is going to end up. So in order to make sure you've got a really nice straight smile, that all of the edges of your teeth line up where they're meant to, and that when you smile, that your teeth are looking nice within your lips, it means we have to control the vertical position of the bracket. In other words, the vertical position of the teeth. And we have to control how much the teeth rotate or derotate and twist and untwist. So the position of the bracket is essentially what determines how nice your smile is going to be. So that first visit when we have the brackets put onto your teeth, that is probably the most important day of your treatment. It's the very first day to making sure the brackets are in an optimal position, so you're going to get a great result at the end.
Perfect. And what one thing would you say you like about this type of brace?
I think it's a very simple, uncomplicated type of brace. It has the least number of complications. It doesn't cause any damage to the teeth. It's low in profile, so that means that it doesn't rub against the inside of the patient's lips and mouth that much. It's easy to clean, and the teeth slide along the wire really nicely, which means that your tooth movement is going to become a bit faster.
Perfect. Can we see one of the other braces here?
So the newer sort of iteration of the metal fixed brace is the more cosmetic fixed brace. So it's very similar. We can look at these side by side. That kind of helps. So instead of having metal brackets on the teeth, we have these white or tooth color brackets, and there's different materials. Our brackets are opaque, so you can't see through them. But other brackets are transparent, so they kind of take up the color of the tooth. It doesn't really matter a huge amount which one you use. We just prefer these opaque brackets because we've had good results with them. The advantage of this is that it's a far more cosmetic appliance, so it looks nicer on the teeth. You can't see it as obviously as you can a metal brace. So a lot of our adult patients would opt for this kind of treatment. I suppose one of the downsides of this brace is that it's a little bit thicker than the metal brace, so it can cause a little bit more irritation to the inside of the patient's mouth. But that's kind of the payoff, is you're going for aesthetics, but understanding that you may not get as much comfort compared to the other brace. Otherwise, it's quite a similar brace. This particular model doesn't have a white wire, but we often use a white wire along with it as well, so that makes it even more aesthetic.
And usually with these braces, there's usually some bands that people see on the braces. Can you just talk to us about what those bands usually are for?
Sure, yeah. So normally, once the wire goes into the bracket, it's held in place by a very small elastic band. So with this appliance, we have a clear colored band, so you won't see them. And all that's doing is holding the wire into the bracket. Because what's important to understand is it's the wire that actually moves your teeth, and the bracket is just there to hold the wire in place. So those bands get changed every time you come in, and you can get different colors, whatever your favorite color is. You can get that, or you can get a multitude. You can have a rainbow if you want. You can do that with the metal brace, or you can do it with this one. It doesn't really matter.
What would you say are the colors to avoid when it comes to bands?
I'd say anything that begins as a yellow color is probably not a good shout, because it'll just look like you have cornflakes in your teeth. But otherwise, the ones to go for are the darker colors, like the dark blues and the dark greens, the metallic ones, mainly because I like the way they look, but also because they have less color degradation. So what that means is, over the few weeks where I'm not seeing you between appointments, the color will be more stable during that period.
All right, let's see the other type of braces.
Cool. So one of the latest ones that we're using is this one. It's made by American Orthodontics. It's called the Iconics brace. So it's very similar to the metal, but it's gold in color. So it's gold, and it gets that from a rhodium plating. So it's plated in a different type of metal to give it that color. And it's just a lot more aesthetic than the traditional stainless steel brackets. Yes, it is gold, but it tends to sit much nicer on the teeth. So when patients are smiling, it's not as obvious as the metal brace. It just looks nicer. It's sort of the halfway house between the ceramic brace, the white one, and the metal brace in terms of the aesthetics. It has the advantage of still being a low profile bracket, so it's not going to irritate the lips and the tongue and the inside of the mouth that much. But it has the benefit of being less problematic with tooth movement, allowing the teeth to move freely and still looking quite nice. So this is the Iconics one. This is probably my current favorite brace to use because it has those benefits of the metal while having superior aesthetics.
Do you find that sometimes you mix and match?
Yeah, that's a great question, actually. Often what we'll do is patients will want maybe the white brace, the ceramic brace for the top teeth, because when you smile, that's what you'll see more of. And then maybe we'll do a metal one on the bottom. This is just to show you what that might look like. I've got two top teeth here, but it doesn't matter. So sometimes we use the white one at the top and the metal one at the bottom. Or sometimes we just use the white one across the front few teeth and everything else is in metal. And what that means is you get an aesthetic result. It helps to control the cost a little bit, but also you get a really efficient tooth movement as well.
Okay, let's see one of the other braces.
So the last two options here, this is the first one. This is the Invisalign appliance, and this is now really entering into its own realm in terms of the cosmetic nature of braces. So Invisalign, I think, is really well marketed, and a lot of people know about it already. Invisalign is just one brand. We use other aligner brands as well. And what this is basically a piece of plastic that is programmed to deliver some form of tooth movement. And you go through a series of these aligners, so let's say a new one every 10 days or 2 weeks, and each one will nudge your teeth along into the final desired position. So you go through a series of these, each one moving your teeth a little bit further. As part of this aligner treatment, what we do is we add these tiny little attachments onto your teeth, and they're added on with a material called composite resin, which is like a white filling material. And these little attachments allow the aligner to hang on to the teeth a bit better, act as levers, and allow for more efficient tooth movement. So these aligners, you got to wear them 22 hours a day, so that's basically full time, apart from eating and cleaning. And you go through a series of these. And the nice thing about it is that you can try to visualize and see your result as generated by a 3D model on the computer before you ever start. So that's kind of the nice part to it. I suppose the downside is it's a little bit more expensive, but it does suit particular lifestyles. So if you're very active, maybe you have a client-facing role or job, maybe you're a teacher, so you want to have something really discreet. Maybe you just really want to enjoy your burgers. So actually you prefer to have something which you can take out rather than something which is fixed and you're constantly hiding when you're eating your burger. Okay. So that's the Invisalign appliance. The last one we have, this is sort of the daddy, really, I would say. This is a fixed appliance, which is on the inside of the teeth, so you never see it. It's all on the inside. It's a custom-made appliance, and we generally make it in the same way we use Invisalign. So we do a scan of your teeth, and then this is made in a lab in Germany and gets sent back to us. Now, this is actually made out of gold, and it's not for any sort of street cred or anything like that. It's made of gold because gold has that property. It's really inert. It can be made into a strong material, even though you're only using a very small, thin layer of it. And it doesn't react with anything that you put into your mouth. And it looks great because from the front, you just can't see a thing. And it has the benefit that, unlike the aligners, it stays in your mouth, so you don't have to remember to put it in. You won't forget to wear your incognito appliance because it's always there. It's always working. So that's why I say it has all the benefits of the aesthetic appliances, along with the benefits of the fixed, and that's why it is the daddy.
So it looks like a fantastic option. As a dentist, I look at that with a little bit of fear of, man, trying to get that on. Do you find that it's straightforward to place?
In a word, no. It is very, very challenging. Luckily, this uses the indirect bonding technique. So that means that it comes in like a tray and that goes into your mouth and it's glued in place. So that makes it a little bit easier, but it's still extremely challenging. And you really have to have a good set of hands to use this brace efficiently. So I think this one is really something which is reserved for the specialist crowd. It's very, very challenging. So not one that I think many practices offer. And I think, again, outside of London, we're probably the one or two practices might offer it. Certainly the only practice in the Northwest to do it. So it's highly specialized, but an excellent appliance.
Okay, so I'm a patient or I'm someone who's looking to get my teeth straightened. I want to know what's the best brace for me to go for. You've shown me all these different types of braces.
Yeah.
What's the best one?
The truth to that question, and I get that question asked every single week, is that it all depends on you as a person and what your life looks like. So as a professional, I'm here to give you all the options, to tell you about the benefits or the downsides of each option. And then I'm here to guide you in your decision making. So it's your decision. So like I said, for example, with the Invisalign, with the aligner systems, if you're someone that has a client facing role, if you're someone that needs to have discretion in their job or socially, then yeah, the aligners are great for you because they will give you the discrete treatment that you're after and still give you a nice result. They might take a little bit longer to deliver. So if time is your key consideration, then one of these three guys here is great because we can put it on really, really quickly. It's very, very efficient in the way it works, and there's no messing about with scanners or anything else. We go straight into treatment. So if time is your consideration or your primary treatment or your factor in looking at which brace you should have, then one of these guys will do. If you're someone that says, you know what, I want time and I want it to be the ultimate in aesthetics, and cost is not a consideration for me, well then go for the daddy. Because this will take almost every single box, and still you'll have an excellent result. So it depends on what you are looking for as an individual, what your budget is, and what you think is the most important factor in determining which kind of brace you want to go for.